These are the 5 best questions you should be asking your doctor. And as a doctor myself, I wish patients ask this. My name is Dr. Story. I've been a chiropractor for over 23 years. I'm going to give you realistic advice based on my experience. Question number 1 that you should be asking your doctor is this treatment for temporary relief of my symptoms, or is it going to have some long-term benefit? Now, this is not a slam on temporary pain relief. Very often, if you've had surgery and they give you Oxycontin or Vicodin or Demerol or some Tylenol with codeine, whatever the drug is, ask the question, is that drug for temporary pain relief, or is it going to help me long term? It's okay if it's temporary pain relief. The reason why you should be asking this question is because if you have a chronic problem, and I'm a chiropractor, so I deal a lot with chronic problems and chronic musculoskeletal problems, it's one thing to just treat the symptoms. It's okay to treat the symptoms sometimes. People have symptoms. They want their symptoms to be relieved. But eventually, you're going to have to start dealing with things long term. So when a patient comes into my office, if I do some different therapies, those therapies are for temporary relief for their symptoms. They should know that. They should not think that putting electrical stimulation or an ultrasound or anything like that is going to have any long-lasting effect. The exercises and the adjustments have the best long-term results. So in my office, I do try to combine temporary pain relief with long-term benefits, but it's important to understand which one does what, because that's going to get you the best results and give you, the patient, greater understanding of your problem. Number 2, what tissue is damaged? This needs to be understood by you, the patient, because very often, I don't know why this is in my office, but I'll tell patients this multiple times, and it'll be their 10th visit, and they'll look up and go, so what's wrong? And I just think to myself, I've told you like 5 times. But sometimes it takes numerous times for people to understand, but you as a patient need to understand what tissue is damaged. So let's do the neck, for example. You need to know what tissue is damaged. Is it a muscle? Is it a tendon? Is it a ligament? Is it a joint? Is it a joint capsule? Is it the disc? Is it the nerve? Is it the fascia? This is just a short list of what tissue is just right there in the back of your neck. So ask the doctor what tissue is damaged and demand from the doctor for them to know what they're working on. The reason this is important is because if you don't know what tissue is damaged, how on earth are you going to know what the treatment is doing for you? It's not uncommon for patients when they come into the office think that it's just a muscle. Because quite frankly, they've never heard of fascia. They've never heard of a tendon. Most people don't know what a tendon is or a ligament. Name for me right now the biggest ligament in the back of the neck. If you don't say the ligamentum nuchae, then how would you even know that that could be a potential cause of pain? So if the doctor knows it's the ligamentum nuchae, what happens is if you don't know what that is, ask the question. But that way it'll help you understand the basis and the reason for certain treatments. Number 3, what are the movements that can cause that said tissue to become damaged? This is an important question to ask because I do a lot of different types of styles of adjusting patients. The primary one that I use is Gonstead, but I've been in practice a long time. I've taken a lot of seminars on different techniques, and so we're very adept at figuring out what seems to work the best for different types of patients. So we don't do the same thing on everyone. But it's not uncommon for patients to bend forward and actually injure joint capsules and ligaments. And by doing extension motions like this, they actually end up taking pressure off those tissues. So it's important to ask, if you're seeing a musculoskeletal specialist like a doctor of chiropractic, to ask them what motions will actually cause my tissues to become more damaged. If you know those answers, you're going to try to modify or change those movements and do the exact opposite. That's the best way to heal those tissues. Number 4, how long is it going to be before I start to notice a difference? I have a unwritten, generalized rule in my office that if I'm doing treatment on someone, I'm expecting to see some type of noticeable change within about 10 treatments. Now, this is assuming that someone is extremely old, that they have a chronic condition. I live in an area where there's a lot of retirement people. So what ends up happening is you have patients that sometimes are 70, 80 years old. They've had pain for 50 years. You gotta give it some time before it makes a change. I always tell patients, think of me as like a personal trainer. I'm just working on your joints and your spine. So you wouldn't go into a personal trainer and expect to see massive changes in 1 or 2 workouts. But in about 10 workouts, the patient should start to notice they can move better, they have greater range of motion, they have less pain. It may not be perfect, but we're getting there. We're on the right path. If someone comes in, and I have patients that are extremely young, you have high school kids playing football, track, soccer, cycling, running, all those things. These people are healing machines. So in those particular cases, my general rule is 3 to 5 visits. So I usually tell patients in about 3 to 5 visits, you should start noticing change in your body. This is an important question for you to ask, because if you have unrealistic expectations, if you're 70 years old, you've had pain since you were 20, that's 50 years of pain, 50 years of dysfunction in your body, and you expect some type of chiropractic miracle, you're going to be very disappointed. So ask the question, how long is it going to take before I start to notice change? And the doctor of chiropractic should give you a realistic timeline. The 5th and final question you should be asking your doctor is, if your recommendation for treatments does not work, what is the next step after that? This is an important question to ask. And the reason why is because we can't help everyone 100% of the time, every single time, in every case. Now I know we're on YouTube, so there's going to be a lot of chiropractors that are going to post their successes. Who's going to post their failures, right? So what you want to ask is, if I see you and let's say the patient is too late to the party, all of a sudden we're trying to improve their movement dysfunctions, we're trying to give them core exercise, we're trying to change muscular imbalances, but it doesn't seem to work on this particular patient. Their condition may be just too far gone, and there are cases like that. What is the next step? Do I need surgery? Do I get a surgeon? Do I try some different method? What are the options? What happens if you fail as a doctor? That's a good question for a patient to ask, and I welcome that question, because in some cases there may be a time when the patient actually does need surgery. We're just trying to keep them and prevent them from having the surgery, or prolong the time that it takes to have that surgery. If that's the case, then I'm going to tell the patient, hey, we're trying to help you as best we can so that you can avoid surgery, or it'll take longer before you need surgery. But I always am upfront with patients and let them know, if I can't help them, I know where I'm going to send them to who. So hey, if you like this video, give me a thumbs up, subscribe to the channel. If you want to become a patient of mine, we do see a lot of international patients. Patients will fly into Los Angeles. I live in an area where there's a humongous outlet mall where people can go shopping. It's basically a hub of where people will shop. We have a lot of hotels around this area, and sometimes patients will come to Los Angeles area and come up to Ventura and shop. And within a week, we could see a patient numerous times and get some results. So if you want to do that, all my information is down in my website, down below. And if you go to the About area on my YouTube channel, you can get that information there.